you go to the dermatology conferences, what do you see in terms of what's the level of interest in this, in terms of, we know there's a lot of interest from women and in the menopause world. What are you seeing in the dermatology world?
It's funny, not a hell of a lot of interest. And
I thought, yeah.
this will sound really terrible, so take it, with a grain of salt. I think that in the skincare arena, the things that many dermatologists look for are things that they can earn some
Make
money
money
from.
on.
Yeah. And so, they get nothing from, writing a prescription for it, but if they can sell it in their office, and that's why MPEL is I think a lot of derms might sell that in their office, but they're not, you don't sell M4 or any of the other estrogen creams in your office. And so I think that has, that.
Yeah, no, it's not a terrible thing to say. It's just an honest thing to say. My own dermatologist, who I really love, she, she's very much like you, very common sense. And like, these are the things that work. And she actually doesn't barely offer or push a lot of fillers and stuff, because she's like, listen, yes, we can use them and there could be a role. But she's like, a lot of the things that are offered are also making a lot of money, right? And so I'd rather people like not think too much and use what works, keep it simple, and use effective science-based things. Not that some of these other things that you pay money for can't be helpful or you might like them or whatever, but let's.
Well, that you asked the question you asked was, why don't dermatologists talk about it more? And I think derms who are interested in menopause probably do, but there's a limited number of us that are like that. Although now every dermatologist is calling him or herself the menopause dermatologist, which is also funny.
But also, I think why are they also, maybe there's less interest there because there's a trickle down, right? It was only a few years ago that even in the OBGYN world, or even just any popular culture, would you even hear someone even admit that they were menopausal? It was like a shameful thing. No one wanted to talk about it. And so it's going to take time. There's a trickle down. And I didn't get any training about menopause in my residency. I seriously doubt dermatology residents are getting large amounts of instruction on what happens to the skin in menopause. Zero, right? And so that's why it's going to take time. And I see it as a grassroots thing. Like, women are interested, they ask the questions, it makes the dermatologist curious and hopefully pushes it.
And they'll learn. I agree.
And then do you think that there'll be any interest from the pharmaceutical industry standpoint of doing studies and developing, because they can make money?
I hope so. I mean, I really hope so. I wouldn't be surprised if it's happening as we're on this webinar. They're, who knows what they're up to. They might. Yeah.
So anything else, because we've got like a minute or two left, anything else that you would like to, tell people about? Anything, skincare, topical estrogen, menopause, how to get information online. And anybody listening to this will be recorded on our YouTube channel, which Allie's YouTube channel is like a free masterclass in all things menopause. So if you've got a friend who you think would want to listen to this, it's going to be on there. And you could also follow Dr. Gendler. What's your handle on social media?
Just my name, Ellen Gendler, MD. Yeah.
Yep. And so follow her, and she's got great information. But yeah, so anything else that you want to
be very suspect when you hear information, when you see information on social media that is out there, and then look for people whom you consider to be experts in whatever their field is. Real experts, not these people that have no credentials whatsoever and are talking about beef tallow and whatever other nonsense. Listen to people who have some gravitas behind them and see what they're saying, and even, write to them. But in this menopause arena, you should be able to trust your menopause specialist gynecologist, and there are some menopause specialist internists who know about it, and a dermatologist who's well versed in menopausal skincare.
Yes, absolutely. And I'll tell people, just because the big pink elephant in the room is always fear of breast cancer in anything when it comes to menopause. So I'll tell anybody listening out there, I'm a 23-year survivor of breast cancer, and I use topical facial estrogen, and I'm not afraid of it. And my friend and colleague, Dr. Eleanor Topolinsky, a great oncologist who's got a great, very informative evidence-based social media, she talks about that really in general, she's not afraid to use it with those patients. So anybody who's got a complicated medical history, this is why we will ask you to, you'll come, you'll see, you'll get information from a menopause specialist at Alloway who will review your medical history, make sure it's appropriate for you. But to just like kind of put it out there, in general, we're really not afraid. We're talking about low dose, safe topical options. So you've got choices
Right.
and options.
Right.
Yeah.
I wouldn't be surprised, Corinne, if in the future there are other types of estrogen-related compounds or estrogen receptor compounds, much like they use in
Like, do
treatment of
we,
breast cancer, that maybe will start being developed topically as well. I wouldn't be surprised.
yeah, yeah, it'll be interesting to see what happens.